thank you all for coming today. According to the CDC website, in the United States, hospital patients get nearly 2 million infections each year. Now, hand hygiene is actually one of the most important ways to prevent the spread of infection. And it is also the simplest and effective ways to prevent healthcare acquired infections. Now, working in surgery, I've been here for several years. I know firsthand how important it is to maintain proper hand hygiene prior to surgery. Now, I want to teach you today the purpose and objective of proper hand hygiene. Also, I'd like to demonstrate to you how to perform a proper surgical hand scrub. Now, first, the purpose is to remove soil and resident microorganisms on your skin, and also to inhibit the rapid rebound growth of microorganisms. The objective is the reduction of transient and resident flora and to reduce healthcare associated infections. Now, choosing the proper product is actually key to this. According to what I call our Bible, the 2012 edition of the ARN, this is a standard for perioperative standards and recommended practices that we go by here in this hospital. Now, our infection control actually is the one who approves the products that we use to scrub our hands with. I have 3 examples here for you. One is called Avogard. It is a waterless system that we use. And then these other 2 use a brush and water. The one that I'm going to demonstrate to you today is the second one here. It's with 4% chlorhexidine gluconate. And on each one of these boxes comes directions on how to use them. And if you're going to use them, you have to follow these directions properly. Now, in each of these boxes comes a nail file or a nail pick, and then also a brush that has a scrub and then a sponge. One of the first things you do before you start scrubbing your hands is if you have any soil or debris on your fingers, you want to remove them with just clear soap and water. The second thing you want to do is always put your mask on before you start your scrub. Now, for the sake of purposes so that you can hear me, I won't put a mask on today. Now, what you want to do is you want to turn the water on and then choose your product that you use. Sometimes they're hard to get open. Okay. First thing, after you get your product open, you want to kind of get your hands wet. Now, I'm just going to do one hand today. Normally you would do both. First thing, you want to get your little nail pick. You want to go under each nail, one at a time, and get rid of any dirt and debris that could be laying underneath them. And then without touching anything, you want to go ahead and throw that in the trash. Now, continue to get your whole hand, starting from your fingernails up to your elbows, wet with water. I'll turn the water off so we can hear. Now, starting with your fingernails, you want to start using the brush and go down each finger, one at a time. You want to be sure and get each finger and in between the fingers properly. Now, according to these directions, you only use the brush for your hand only. After that, you start working down your arm with the sponge, down to your elbow, making sure to keep your hand up and your elbow low. Go to your elbow without actually scrubbing your elbow. Once you do this, go ahead, rinse. Keep the water down and repeat. All right. Now you can take your brush throw this in the trash, turn your water back on, starting again with your fingertips, working all the way down to your elbow, and you're ready to enter the room. Now, again, according to the CDC website, the AORN book, you should have all your information here and know how to do a proper hand scrub and keeping your patient safe. Now, education regarding proper hand hygiene is key to maintaining successful surgical outcomes so that you won't be the cause of your patient acquiring an infection. Thank you.